Good afternoon. My name is Mary, and I'm the Communications Director in Congressman Larson's office. Thank you for joining our Teletown Hall. This afternoon, we will be discussing the coronavirus. This is an interactive forum, and we would love to hear from you. We'll be taking as many questions from constituents as we possibly can on this event. If you have a question, you can press *3 on your phone keypad at any time, and you will be placed in line to speak with a member of our staff. Once again, that is *3. They will take down your name and a brief summary of your question. The next time you hear your name, you will be live on the call and you'll be able to ask your question directly. If you're streaming the event on our website, you can simply type your name and question below the streaming player. We will do our best to answer as many questions as we possibly can this afternoon. We receive a lot of questions on our live events, so if we are unable to address your question, please leave a voicemail after the event. Again, if you have any questions throughout the event, please press *3 on your keypad or type them below in the streaming player. Now I will turn it over to Congressman Larson.
Thank you, Mary. And let me start by saying how honored and fortunate we feel that we're going to be joined by Governor Lamont today. And I thank him from the bottom of my heart, first and foremost, for the stellar job he has done in addressing this crisis. You know, comportment in the office is incredibly important, but never as much as it is during a crisis like this. And I couldn't be prouder of the actions of our governor, mindful first and foremost of the public's health and keeping people out of harm's way and taking difficult but necessary action and leading as he always does with a calm and steady hand at the keel. We are fortunate and blessed to be so well served here in the state of Connecticut. I want to also commend my colleagues, both our United States senators who did an outstanding job in terms of working together with the House to get some recalcitrant Senate Republicans to understand the depth and expansive nature of this crisis and to improve the third phase of this package. Both Senators Murphy and Blumenthal deserve an enormous amount of credit. In speaking with the governor, I know how grateful he is that both in the first, second, and now third packages, we have been able to deliver vital services and resources, especially to our states and municipalities that need them the most. And as you've heard me say in many instances, this is a time for the nation to pull together. This is a time, and I especially want to compliment the governor as well. Yesterday being no exemption, when President Trump seemingly spoke just off the top of his head about possibly quarantining New York, New Jersey, and Connecticut, you can imagine the shockwaves that sent through all three states. But as usual, Governor Lamont handled it in the calm and endearing and reassuring manner that we've all become so accustomed to in the way that he has handled this crisis, in the way that he has comported himself in this office. This is not a time to be critical of anyone. This is a time for all of us to pull together, and that's what we're going to continue to do, and that's what this phone Tele Town Hall is all about today. I'm going to quickly bring you up to speed on where we stand, and then also turn it over to the governor for his comments. I would acknowledge that the governor does have to leave, so after his comments, he's going to be doing yet another teleconferencing and with Johanna Hayes from the 5th Congressional District. So, Governor, thank you so much for being available, and thank you for everything that you've done. As the CDC has stated, this is a public health crisis that needs to be taken seriously. And that by no means panicking. In fact, it means quite the opposite. I've been heartened everywhere that I've gone across the state, whether it's standing in line to get groceries or whether it's seeing the response on so many of our citizens that are willing to pitch in and help out and understand the gravity of the situation at hand and are taking seriously the concept and ideas that we must follow, especially as it relates to social distancing. This virus spreads person to person, and you do not always know if you have symptoms, so you could unknowingly infect someone else. If you are sick with symptoms that are like COVID-19, a fever, dry cough, please stay at home and call your doctor. Do not show up at an emergency room, emergency urgent care or your doctor's office without calling first. You might end up spreading the virus unnecessarily. If you have questions, and here again, let me commend the governor, please call the state's information line, 211. They will be able to direct you on steps to take to get tested, take care of yourself, and protect others. The governor has required stay safe, stay home, and close non-essential businesses in Connecticut. In Congress, I would like to let you know that we are also taking this serious and attempting to provide all the resources we can to fight this epidemic. We are just through passing this past Friday the third package. Let me quickly review those. As you may recall, and especially this being the sixth such conference that we've had, a few weeks ago, we passed the first package, an $8 billion emergency spending bill for COVID-19. This package provided funds for vaccine development, therapeutic development, for masks and other protective equipment for healthcare workers, as well as small business loans. The president also declared this a national emergency under the Stanford Act, enabling government to access $50 billion in disaster relief funding and allowing more flexibility to respond to an emergency. The second package that we passed was what we call the Families First Act. Again, I would like to just assure people on the line, this being a health crisis, that it's the health crisis that has to come first. That's not to say that there isn't concern about the economy. We all share that. But first and foremost, and the governor has been right about this, and clearly the focus of the House of Representatives and Congress has putting the health concerns of people first. Because if we don't get our arms around the health crisis, then it won't matter what we do with respect to the economic crisis. And we can both walk and chew gum, so let us make sure, though, that we put the cart, in this case, we don't put the cart before the horse, that the horse in this case is the health and well-being of our citizens, and their well-being is of utmost concern. In the second package, what the law required for is for employees and to offer paid sick and family leave. Family First also provided food assistance for seniors, for children, which was also particularly important now that schools have closed in Connecticut and across the nation. The House version of the third package called for more funding with respect to family and medical leave. Unfortunately, that was rejected by the Senate Republicans. But the third package, and the one that we just adopted, was a $2 trillion package, as I'm sure you've heard and read, the largest in the history of the country. The third package, which is called the CARES Act, was signed into law by the president and provides critical support for all Americans and small business. It provides direct cash payments to lower and middle class Americans. For many of you, this will be paid as a direct deposit. By that, if you directly deposit or enact with the IRS through your bank account, then you will receive a check directly in your bank account. If you process through the mail, it will take a little longer, and you will be mailed a check. However, this expands unemployment benefits to cover all workers, including the self-employed, gig workers, and those who have reduced hours. It extends unemployment benefits by 13 weeks and increased weekly benefits by $600 per week for 4 months. It was ironic that was somewhat of a stumbling block in the Senate, especially given the bailouts in the past of so many corporations and large businesses, that there would be an upset that for a 4-month period, someone would receive a little extra unemployment money so that they could make ends meet and pay their bills. This instituted incentives to business to keep employees on the payroll. More than $350 billion of loans up to $10 million in effect for 2.5 months. Loans that will be entirely forgiven, provided the businesses maintain their employees and their employees' salary. We have to give a huge, we want to also note that there were critical resources provided to the National Guard as well. And institutes establishes a $100 billion fund for hospitals and healthcare providers so that they're able to treat patients. I'm pleased to say that I spoke with most of the CEOs and presidents of our hospitals in the 1st Congressional District. They have all acknowledged how grateful they have been to the governor and his leadership, and also for the timely basis in which this money is going to be sent out to our hospitals, and truly our heroes, the healthcare providers on the front lines, the doctors, the nurses, the staff workers at our hospitals. Again, all the more critical reason why you follow the governor's guidelines and suggestions and making sure that appropriate screening and dialing 211 first. First and foremost, your family physician or healthcare provider if you have one, but absent that, please dial 211 to make sure that you're being directed in a way that will both save lives and also help us in the ease of making sure that we get through this. We also allocated a $14.25 billion for institutions of higher learning. And this is very critical, again, talking to the presidents in the 1st Congressional District, whether it be Trinity or whether it be the University of Harvard or UConn and the UConn Law School, whether it be Goodwin University or Manchester Community College, talking to all of how appreciative people were. But we especially want to give a shout out here again to our healthcare workers. During times like these, you are what is pulling the nation together. You are the heroes who are on the front line, putting themselves in harm's way to care for the sick, and our essential workers and first responders who are keeping this country running. We're living through an unprecedented time, and we're asking our healthcare professionals, first responders, grocery employees, and other essential workers to continue to work. So should Congress. That's why it was essential for us to go back there and vote. And I am proud of this entire Connecticut delegation. As we go forward, we're going to need more relief. And as we hear from you, we want to address your concerns as well. But as Franklin Delano Roosevelt's close advisor, Francis Perkins, said during the Great Depression, we must devise plans that will not merely alleviate the ills of today, but will prevent, as far as humanly possible, their reoccurrence in the future. We want to make sure that the principles that we apply in assembling the next packages of relief that come out to our citizens are done in a manner that don't just simply address the emergency and the crisis at hand, but lay the foundation and the critical mass for the future and provide our citizens with that kind of solution. At this time, I'm going to remind you that to press *3 to ask a question, and now it is indeed my honor to present the governor of the state of Connecticut, who has done just an extraordinary job in leading our state through this crisis. Governor Lamont, the line is open.
I'm here. Hey, John. Hello, everybody. John, you taking the lead in Congress made an enormous difference. You reminded Washington what they had to do to step up. You got this bill launched, and then Murphy and Blumenthal made it a better bill in the Senate. And I'll tell you why I think it's a better bill in a minute. But your real focus is right. This is a health crisis. We have a medical shutdown that's affecting the economy, but it's a health crisis. And if anything has surprised us at this point, our modeling, working with our hospitals, working very closely with our hospitals, the infection rate is sort of what we expected. How it's going through the state, starting from the southern part of the state and moving up. Right now, Fairfield County is part of the New York City pandemic is the focus, and we try and allocate the capacity among our different hospitals right now. And what I've learned is folks over the age of 60, over the age of 70, 10 times, 15 times more likely to be hospitalized. And obviously, sadly, that's where the fatality is as well. So when I'm talking about social distancing, I'm really trying to focus on everything we can do to keep our seniors at home and everything I can do to get young people to take social distancing seriously. Even though the chance of them having real COVID-related complications is low, they are carriers, they can infect, and they make their families and their friends a lot more at risk. So that's what we're really pushing on. And we've had some good positive effect on that, in the fact that we're holding the line in terms of our infections a little bit right now. It's still too early. John, you were describing the package and the packages that have gone through the House and the Senate. Let me tell you one thing that I think made them particularly relevant to what's going on now, and very relevant to what we need in the state of Connecticut. This is not your father's garden variety recession where you go down and you have too much supply and not enough demand, and then you come out. And this is a medical shutdown of about 30% of our economy. So it wasn't simply a matter of if the House and the Senate of Congress had just given everybody a tax credit or a tax cut, sort of some of the traditional things. That would have been irrelevant to our situation. Our families, our working families, our small business saw their revenue disappear in a week. And a lot of that was, I'm afraid, due to some of the orders that I had to put in place when it comes to bars and restaurants and even retail, and doing everything we can. And that's why, John, the bill that you helped craft was so relevant. You didn't give small businesses a loan that they'd have to find ways to make money. You gave them a grant if they keep people on board. And that's enormous to get that money going to them now, so they can power through the next 3-4 months, whatever this may be. And then they're ready to hit the ground again when we get the COVID crisis behind us. That's why $1,200 to folks who all of a sudden saw their income dry up was invaluable. And I'll tell you, as a governor, thank you for the discretionary money you're giving to governors, because we know exactly where that money's got to be targeted, starting with our local mayors and first selectmen. What we've got to do in terms of a lot of our basic service needs is a lot of our income is gone. And finally, thank you for remembering the hospitals. These folks, they've lost a lot of their revenue. They used to make more revenue doing some of the discretionary elective surgery, and now they are working overtime. And often we don't have the PPE that they deserve. And our universities and hotels are providing space so nurses and doctors can stay close to the hospital and get back to work the next day. And through the generosity of some of our donors, we've been able to create daycare facilities at each and every one of the hospitals so that nurses and doctors know they have a safe place for their kids, while they're at work. I'll tell you just very briefly, you mentioned some of the language coming out of Washington could be a little confusing for us. And the comment yesterday from the president where he said we ought to think about a mandatory quarantine for New York City, Jersey City, and Fairfield County. Words matter. And when you're not clear about your intent, that lack of clarity can create confusion, and confusion can lead to panic. So when we heard that, we didn't know what a mandatory quarantine meant. Maybe it was what we're doing already with our stay-at-home policies. Maybe it was what we're doing already when we say if you leave the state, we want you to quarantine, or you come into the state, we want you to quarantine. But it also had images of lockdowns. And that's why we worked very closely, our fellow governors. And frankly, the president and his team got on board with us. We had good conversations there. And I think the president did the right thing when he said what we mean to say is, an alert in terms of making sure that all traffic stays home. And if you have to leave, you have to be quarantined going forward. I'll leave you just with one last note, little frustration, John, with the federal government here, and maybe you can help us out with this. But we have worked really hard with the hospitals early on. We got our orders in place for surgical masks. We got our orders in place for PPE, the protective gear that not only our nurses and doctors need, but folks at nursing homes and our first responders and our police and our cops and daycare, all of whom need in order to do their job on a safe basis. We had our ventilators ordered. We have about 900 in the state, but we need at least another 1,500, and we were prepared for this. And that material was ordered. It was on the tarmac. It was guaranteed from a very reputable group. And at the last moment, it got repositioned somehow, and we lost access to it. And so for us, it's really important that we get that support we need from the feds. We had our order from the Strategic Reserve the other day, and they just put us into the back of the bus again, arguing that there are other states that were more urgent. And we're all working in this together. And we talk about more urgent. Connecticut is part of that New York metro area, and we're part of that same urgent care. And the great thing about John and folks that you're representing in the first CD in the northern part of the state, we do have a little more time to prepare, and I got to tell you, we are getting prepared. And masks and thermometers are going to be here to make sure the folks working at Pratt and others in major manufacturing facilities can do so safely. And I just leave you with the thought that I've never been so proud of the people of Connecticut. And I'm doing my best to tell people the truth and give a consistent update on exactly where we are. You know what my frustrations are. You know where the work is we got to do. But you also know what we're doing. I mean, we had 1,000 nurses come out of retirement in the last week and roll up their sleeves and say, we're ready to help. We're now trying to recruit young people so we can deliver food and pharma and errands for the shut-ins and the elders who have got to stay at home. We have thousands of people who are self-quarantining, and the people of Connecticut are stepping up. And we stick together. We're going to get through this together. And I'm proud to be your governor. Back to you, John.
Well, thank you, Governor. And we are so incredibly proud of you. And we share your frustration. I would add that especially, as you point out, Connecticut being strategically bookend between both New York and Boston, where Boston is also exponentially seeing a growth rate of the virus, and it is spreading south to Connecticut. And as you pointed out, in New York City, in Fairfield County, where the epicenter of the virus is spreading south to New Jersey and north to Connecticut. So Connecticut is actually being bookended by two metropolitan areas. And for the CDC to make a strategic decision otherwise than to get the kind of PPE, again, the equipment that is so desperately needed for those on the front lines, and including our first responders, and even, these these people who man our grocery stores. I mean, they just have been remarkable. Governor, your words, you couldn't be prouder of the people of Connecticut, I think echoes the sentiments of so many people, and countless number of anecdotes of people who are stepping up and asking what they can do to help. And first and foremost, it's to follow your edict and to stay home and stay safe and to practice social distancing and to do everything that we can to limit the spread of this, but also the willingness on the part of people to pitch in. The story of the 1,000 nurses is impressive, but every vendor that I've talked to, and many whom were in difficult financial situations themselves, were stepping forward and saying, is there food I can supply to the homeless and to children or to seniors and people that need it? And what can we do to make sure that this all works together? And thank you, Governor, also for underscoring again the necessity to keep, so many of our important businesses whole and ready to go, that as we all hope and pray as this virus passes, and it will pass, and it will pass quicker if people adhere to the very bold and necessary decree that you issued early on, which will save countless lives and also, I think, expedite the passage of this virus that we can't just yet get our arms around, but with everybody working at it, with people putting their shoulders to the wheel, and with people in Congress acting nonpartisanly, bipartisanly, with few exceptions, to make sure that we're doing everything that we can on behalf of the citizens of this state and across the nation. Governor, thank you so much for joining us. I know that you have to go, and we are about to open this up to questions. We get a lot of frequently asked questions. I'm going to read just a couple of quick ones here so that I think it will provide you, if you have a question about the most recently passed bill, this could give you some of the answers here. But the question is, I didn't make enough money to file taxes in 2018 or 2019. Will I be eligible? Answer: yes. Every non-dependent legal resident within the income range with a Social Security number is eligible. Even if you have not filed income taxes, the IRS may have your information. If you have previously received unemployment compensation, or if you receive Social Security retirement or Social Security disability payments, the IRS may already have your information. If you have not filed taxes or participated in these programs, the IRS will be announcing a process to submit an application. The IRS strongly recommends filing a 2019 tax return as soon as possible, which will give them up-to-date information. How much will I receive under this bill that's passed? The CARES Act provides a single one-time payment of $1,200 per adult and $500 per child for Americans making below $75,000, or $122,000 if filing as a head of a household, or $150,000 if filing jointly, as well as for those receiving Social Security, SSI benefits, VA benefits, and railroad retirement benefits. For individuals with income between $75,000 and $99,000, the rebate is partially paid. For a head of a household with one child between $122,000 and $146,000, the rebate is partially paid. For joint filers, between $150,000 and $198,000 is partially paid. For a family of four, the rebate is not eligible for a family with an income above $218,000. How will these payments be delivered? If you have given the IRS your bank information and permission to deposit funds since January of 2018, it will be delivered via direct deposit to your bank. You will receive a paper statement a few weeks after the transfer notifying you that the payment has been made and into what account. If the IRS does not have your bank account information but does have your other information, you will receive a physical payment in the mail. If the IRS does not have your information, the IRS will be announcing a process for you to receive a payment. If I receive a federal benefit that's limited by income levels, will taking this benefit impact my eligibility? No. This payment is considered a tax refund, and so it will not be considered income for determining eligibility for federal programs. When will I receive my payment? The goal is to distribute funding as soon as possible. The IRS has not announced their expected timeline, but payments that can be direct deposited will have the fastest distribution. What happens if I've had a loss of income since my last tax returns? Am I now in the range of payment? You will be eligible for this credit when you submit your 2020 tax returns. The IRS may announce future instructions on assessing this credit prior to filing. What happens if I've moved since I last filed my taxes? The IRS will release information on how to update your address with them. Will I have to pay taxes on this payment? No. Again, they are considered tax refunds and not subject to a tax. I'm 17 to 24 years old, and my parents listed me as a dependent. Will either of us receive anything? No. If you're a dependent age 17 to 24 and your parents claim you as a dependent on their tax return, you are not eligible for any recovery rebate. You are not eligible for a rebate for children either. The $500 rebate per child is for those under age 17. If I was contacted about claiming money from the government as part of a coronavirus relief, is this real? At this time, no government agency, including the IRS, has done outreach to request information related to the program. Do not give out personal information to anyone contacting you or claiming otherwise. For more information about how to know if government program is real or to report a potential scam, go to ftc.gov/coronavirus. And now we'll open it up to questions that you might have.
Thanks, Congressman. Just a reminder to everybody, if you would like to ask a question, please press *3 on your keypad. Once again, that is *3. And then if you would like to join our newsletter, please press *6. Once again, to join our newsletter, please press *6. And now we have Betty Knox on the line. Betty, please ask your question.
Hello. Hello, are you there?
I'm there, Betty.
Yes, hello.
Okay, first thing I want to say is I am absolutely blown away by the way that our governor has handled this whole pandemic. He has gone above and beyond while showing remarkable restraint. Not an easy thing to do. He's done an incredibly good job. Now, here's the issue. I know that everyone talks about, and I understand that the hospitals and nurses and doctors all need equipment, the masks, the ventilators, and all. But we have first responders out here. My daughter is an EMT who told me just an hour ago that they are down to 1/3 of a box of masks at her ambulance service, and they don't know when they're going to be getting any more in. Do you have any idea of how quickly these supplies are going to be going to the absolute front lines, the responders who are there really first?
No question about it, Betty, and thank you for your question, and kudos to your daughter, and let me echo your sentiments about the governor and the way he has comported himself as the Chief Executive Officer of the state of Connecticut. What an example for the rest of the country. But in the bill most recently passed, there's $400 billion in FEMA grants for first responders, and that was specifically so that what is commonly referred to as the PPEs, and that's the masks, the gloves, the gowns, the respirators, et al., are getting out to those individuals. And anecdotally, we've heard the same stories, and that's why, and it may seem like a long time, but for Congress to have acted as on that much money, $2 trillion in a short period of time, was commendable, but a far cry from the commendability of what first responders, doctors, nurses, healthcare providers are doing on a daily basis, and as you say, putting themselves at risk. So I know, and you heard the governor mention that he had made a procurement, and for some reason the CDC pulled that away. We are looking into that as a congressional delegation and are all over this because, as you may have heard me say, we are bookend in Connecticut between Boston and New York, where we've seen New York has become the epicenter of the virus, and Boston is not that far behind, and it's spreading north from New York and south from Boston, and Connecticut is right in the middle, and all the more reason to make sure that we follow the guidelines, but also that we're equipping our first responders with this vital material. And we will continue to push them to get that out the door and demand questions from the CDC as to why strategically they shouldn't be sent to a state as vulnerable as Connecticut, and I would dare say Rhode Island as well, caught in between that mix as well. Thank you for your question, Betty.
Great. Thank you, Congressman. As a reminder, to ask a question, please press *3. And if you would like to join our newsletter, please press *6. Next, we have Alyssa Trachtenberg on the phone. Alyssa, you are now live with the Congressman.
Hi. Thank you very much for all your efforts, and the governor as well. I had some questions that don't come up yet a lot, and some of them are tied to PPE, but it's more tied to the duration of this. And so two things. First, when you look at all the other countries that have been successful at flattening the curve, they've all had national efforts for, a national stay-at-home. They test, they trace the contacts, and then they isolate. And they also have the equipment. And I wanted to know, question one, if there's anything you can do to compel the president to fully implement the Defense Production Act to get everyone who needs all the required PPE, like Betty's daughter, the PPE they need in all the states, and if there can also be a nonpartisan group to oversee it, because I just read that Florida got everything they needed, and as we know, that's the president's home away from home. And my other question is, everybody's talking about this ending soon, but for people like myself who have congenital heart disease or other underlying conditions or who are elderly, we're really not going to be safe until, let's say, like 18 to 20 months out when there's a vaccine, and it's also mass-produced, and everybody's been inoculated. So are you guys thinking about measures that you can take further in the future to help protect us, and things for those of us who are young and have families or people living with us so that our children can continue to do distance learning, or our other family members can work from home so that we stay safe and don't die?
Well, first and foremost, thank you for your question and the thoroughness of your question. And to say that we share your concern, and as I said at the outset, I have tried to refrain from being overly critical of the president at a time when we all need to lock arms and pull together. But we have introduced legislation that would force the president to immediately exercise the powers in the Defense Production Act to increase the manufacturing of ventilators, N95 masks, as they're referred to, and other critical medical supplies during this crisis. And also, and listen, every president should always try to quell people's fears and appear hopeful and aspirational in terms of how we're dealing and working through this crisis. But thank God for Dr. Fauci, who also is there to realistically assess from a scientific standpoint how we will handle this as we go forward, and what are some of the remedies. And as you point out, as we wait for a vaccine that will inoculate us, what are the strategies and what have we learned? I couldn't agree with you more that we need a national policy. Obviously, a number of us are concerned, but not the least of which are the president's own advisors, that regionally there may be some parts of the nation that are not experiencing, but every single state has reported outbreaks of COVID-19, and all the more reason to institute policies that both in the short and long term are going to keep us safe, and that above all else, we should be making sure that science and medicine and the health and well-being of our citizens is always going to take precedent, as important as the economy is, and as much as all of us want to see it succeed, that it's the health and well-being of people that will come first. And I would, stay tuned, as we like to say, as we continue to inform and update, and we hope educate the American people with the latest breakthroughs and the latest information in terms of how we deal with this ongoing crisis. You point out other countries. Let us also hope, from a good news perspective, that there is a point where this peaks and then begins to fall. And let us also hope, and we're encouraged by a number of things that we're hearing, but we have nothing specific yet. Encouraged by what we're hearing, but nothing specific yet. But all the more reason to keep on investing and to roll up our sleeves. When this country puts its mind to it, we're usually pretty good at solving problems. And so that is our hope, and we're optimistic for it. But in reality, we've got to follow science and the facts and the data. And thank you for your very thoughtful question.
Thank you, Congressman. As a reminder, if you would like to join our newsletter, please press *6. Now I'm taking Ethan Pelletier live. Ethan, you're now live with the Congressman.
Thank you. You already partially answered this question, but I just wanted to ask it anyways. Regarding the payments made to Americans in the bill passed by the Congress, will they be taxed or returned to the government in any way, or is this a one-time payment with no strings attached?
One-time payment with no strings attached.
All right, thank you. I appreciate it.
No. You'd be surprised how many people have called and asked that, and rightfully so, because people are out there struggling to begin with, and then they're saying, well, look, I don't want to get something from the government only to find out that, I'm living what bare threads that I have. I get money and I spend that only to find out that I owe taxes on it. And no, it's considered a one-time refund. Thank you for your question.
Great. Thank you so much. Next, we're going to take Alan Mazzacaro live. Alan, you should now be on live with the Congressman to ask your question.
Hi, Congressman Larson. I thank you for all your information. My question is, I had a mother in a convalescent home that died recently, and
sorry.
My girlfriend. Thank you. I appreciate that. My girlfriend's mother is in the same place, and she is a personal care assistant, and she takes all the precautions necessary when she's taking care of her clients, and she just wants to know when they might lift the restrictions so that she could go in and see her mother, because she's been dealing with this for 8 years, and she's been part of the care of her mother's care. She helps to change her at night and do some of the things that the staff is overworked and doesn't have time to do. And I would just like to know if there's any way possible they could let her in to see her mother, even if it's just for an hour a day, and she was willing to take all the the precautions, to wear the gloves, the mask, and so forth.
Well, thank you. That's certainly our thoughts and prayers go out to you over the loss of your mother. And from a compassionate standpoint, again, we get many questions like the one that you've just asked. The answer is that is a decision that, again, is made by the healthcare professionals and the doctors and the nurses at the facility. And you may have heard Amy Klobuchar, Senator Klobuchar, explain the other day how her husband has contracted the virus, and she can't even go visit him. And, these are very painful things, and as you point out, especially in as much as your wife has been giving the kind of extra special care that, frankly, only family members and human beings can. It's just the love and companionship and knowing that someone's there who's always been there for them, and it goes both ways, and you feel incredibly hopeless. But the nature of this virus is confounding. But I would, if I were you, meet with the people running the facilities and who's ever in charge health-wise to see with the right precautions if that's possible, but it's a decision that's made by them and in the best interest of all concerned. But thank you. It is a compassionate and caring question that comes up often.
All right, thank you. We're going to be taking our last question momentarily. Just a reminder, if you would like to sign up for the Congressman's newsletter, you can do so by pressing *6, and one of our staff will take down your email address. Once again, that's *6. Karen from Manchester is now live on the line. Karen, you can ask your question.
Thank you very much for the opportunity, Senator Larson, and all your hard work, and Senator Blumenthal and Murphy also, and the governor. My question is, I have several friends who have been on unemployment and their benefits have run out. Is there any way that they can re-sign up without having worked in between to collect unemployment benefits?
Well, yeah, as part of the CARES Act, workers will be eligible for an additional 13 weeks of unemployment. Given unemployed workers a total of 39 weeks, Connecticut is currently in the process of implementing this change, and what I would do is have them go to filectui.com. That's file, filectui.com for more information. But the CARES Act did provide an additional 13 weeks of unemployment. And again, as I indicated, we expect that depending upon how this goes, we're going to need to have, we've passed 3 packages to date. We're going to pass probably a 4th and a 5th package. Many of you may have heard me speak about the need for us, especially in the area of Social Security and our elderly, the people that are the most vulnerable to this coronavirus, that we should make sure that we're acting in a way that after the crisis is through, that they are receiving benefits that frankly haven't been adjusted in more than 50 years to enhance Social Security, in more than 37 years to make it sustainably solvent. And we will be attempting to put that in the 4th package. You may have saw that Elizabeth Warren and Senator Wyden and Schumer, and I know both Senator Blumenthal and Murphy were involved as well in trying to enhance Social Security benefits in the Senate package, but it was rejected by Mitch McConnell and the Republicans. So we're going to hopefully get that in the next House package that comes through, and it'll be adopted because it's vitally needed aid as well. We will continue to update you and have forums. We hope that you find this feedback valuable. You can, as always, contact our office, and I want to thank my staff and the staff of a number of governmental agencies that are also working overtime during this crisis to make sure that we're answering questions and dealing with people's concerns. And even though the bills have passed, now it becomes a time to make sure operationally they go from the executive branch, in this case the Treasury Department and the IRS, back out to the people that are impacted by them the most. And whether it's an unemployment check, whether it's SSI or Social Security, railroad pensions, veterans checks, whatever the case may be, they will go out through the IRS, and we will be monitoring this and hoping to get it out as quick as possible. In the meantime, please, as the governor has requested, stay safe, stay home, and let's make sure that we all continue to be neighborly and good citizens. It is heartening to see how so many individuals and how many businesses and people are stepping up. It's truly a great sign of just how great a nation we are, how good a people Americans are, especially when we appeal to our better angels and appeal to all pulling together. This disease is not, doesn't target any political party or ideology. It's a common threat and a common enemy that requires all of America pulling together. Thank you, and God bless you, and God bless America.
Thank you, Congressman. We are at the end of our live event this afternoon. If you are not able to get your question this evening, you can leave a voicemail after the event. We will host more of these events in the future to keep you informed on what we are working on, the resources available to you, and other important updates. Thank you so much. And once again, if you would like to join the Congressman's newsletter list, please press *6, and I hope you have a good rest of your Sunday. Thank you.